Okay, so Assalamu alaikum everyone. My name is Mehwish Sheikh. I'm a PhD scholar from Mehran University of Engineering and Technology, Jamshoro. So I'm here presenting my research in a 3 minute thesis competition. So the topic is about PneumoVision AI, next generation detection and segmentation for smarter healthcare. So imagine walking into a clinic with a simple cough and walking out with a life-threatening disease that nobody caught in time. This is the reality of pneumonia. It can strike anyone, young, old, healthy, vulnerable, and the difference between recovery and the tragedy often depends on a single chest X-ray. But pneumonia is hard to see, even for the experts, for radiologists, and missing it can cost lives. So the problem why it matters is because pneumonia remains one of the deadliest respiratory infections worldwide, contributing to millions of deaths every year. Doctors rely heavily on the chest X-rays, but pneumonia lesions can be subtle, overlapping with the bone structures, easily confused with other lung conditions, and even in many regions, there are simply aren't enough radiologists. When the workload is high and the findings are subtle, misdiagnosis and the delayed treatments becomes more common and unpreventable. So the idea is that I asked that can artificial intelligence helps us to see what human eye might miss and support doctors without replacing them. So this led to PneumoVision AI, a system designed to both detect pneumonia and pinpoint the infected regions in the chest X-rays. So think of it as a reliable, tireless, as a second reader, one that provides the clarity, consistency, and the confidence, especially where expertise is very limited. So the core innovation of my research is that it doesn't rely on building the bigger or more complex or complicated models. Instead of it, it focuses on teaching AI models more intelligently. So, PneumoVision AI learns through feature-enriched representations that captures subtle patterns in the human that often miss. So, self-supervised learning using the knowledge extracted from large pools of unlabeled X-rays, clinically designed segmentations, ensuring that it highlights the lesions that are truly reflected the medical reality, not the artifacts. So it ensures the more accurate, more stable, and the more explainable to the clinicians. And it is crucial for the efficient computation and making real world deployment practical. So the impact of this work is that its implications is more faster, more reliable, more better decisions, support for clinicians, especially in the high burden or the low resource settings, and it's more accessible to diagnosis even when the radiologists are very rare. So it's better and earlier treatment, proving the improving the outcomes of the patients of all ages. So I must say the core of this research is that it brings us closer to the world where every patient anywhere gets an accurate, timely, and reading of their X-ray. So PneumoVision AI is not just a technology; it's a pathway to safer, smarter, and more equitable healthcare. So thank you so much. This is all about my research. Thank you.